If you're looking for help with your memory, or if you're looking for help to strengthen and repair your liver, there's a supplement called phosphatidylcholine. It's also known as PC, and it's definitely a supplement for you to consider. The way it works is PC is a critical part of every cell in the human body. It breaks down fat deposits, and without PC, fat actually becomes trapped in the liver. PC's best documented use is for improving liver damage, and more specifically, speeding up the functional and structural rebuilding of liver tissue. PC is potentially beneficial for repairing the liver due to hepatitis B and hepatitis C, and people who suffer from alcohol-induced fatty liver disease and who are also deficient in choline may see improvements in their condition after they've supplemented with PC. A second promising use for PC relates to your cognitive health. The body uses PC to make a brain chemical involved in memory, and because its levels decline with age, PC may help people with Alzheimer's disease. Clinical studies have not yet supported this theory 100% with the Alzheimer's disease, but certainly people with mild to moderate dementia may benefit from supplemental phosphatidylcholine.
What is metabolism? Well, basically, it's very simple. It's a bunch of reactions that goes on in the body that takes food and converts it into energy. It measures the amount of energy that is being processed in the body. It's, for an example, I'm going to show you with a car, you know, when it's got good stuff in it, like good gasoline, good oils, and it's well-tuned, that thing's running at a top speed. Well, that's what I want to teach you guys how to do with your metabolism, is get it running at top speed. Okay? So, what happens when it's not running so good? What happens when you're putting the wrong foods in it? How do you feel? Well, let's see. At 2 o'clock in the afternoon, I need a coffee, or I need an energy drink just to get me through the day. How would you like to eliminate all that? Get your metabolism running to a point where you are running at full speed all day long. Wouldn't you like that? I bet you would. I'm going to show you how you could get your metabolism running smooth so you could have a hot, smoking body.
Hi there. Want to improve your gut feeling? Almost all Europeans visit a gastroenterologist at least once in their lifetime to undergo treatment or diagnosis for a health condition inside the digestive system. A key part of the digestive system is the gut, which is filled with good and bad microbes. A gut with too many bad microbes can cause health conditions like tiredness, diarrhea, headache, and immune dysfunction. In the longer term, such an unbalanced gut may even contribute to the development of colon and liver cancer, diabetes and obesity, inflammatory and irritable bowel syndrome, celiac disease, and arthritis. Scientists also suspect links to mental health problems as well as Parkinson's disease and Alzheimer's. Good microbes, on the other hand, can keep the gut in balance. They help us decompose the food we eat, stimulate cell growth, strengthen the immune system, and prevent allergies and diseases. We preserve and acquire good microbes through a diet with high-fiber foods, including vegetables, legumes, fruits, and whole grain and wheat. We are only just beginning to understand how gut microbes and the human body interact. Future research may reveal many more links. What we do know is that the gut is playing a key role in our overall health. We should treat it accordingly. So, look after your gut, and your gut will look after you.
Cardiovascular disease involves abnormalities of the heart and blood vessels. Coronary heart disease is the most common condition and is the leading cause of death in the United States for both men and women. The lifetime risk for developing significant cardiovascular disease is greater than the likelihood of developing cancer. Your heart is a muscular pump that requires heart arteries to supply oxygen-rich blood to keep it going. Coronary heart disease occurs when these blood vessels become narrowed due to a buildup of plaque. The plaque is made up of cholesterol and other substances. This process is called atherosclerosis. Atherosclerosis occurs over a lifetime and is influenced by risk factors. Some risk factors can't be changed. However, others can be altered through healthy lifestyle choices and medications if needed. Symptoms of coronary heart disease occur when the heart muscle does not get enough oxygen. Some describe this as chest pressure or chest pain that starts over the left chest and can radiate or travel to the left arm, left jaw, back, or sometimes to the right chest. Some patients do not have any chest pain or pressure symptoms, but instead have intense shortness of breath or epigastric discomfort that can feel like a bad heartburn. Breathlessness, nausea, vomiting, or sweats can also sometimes be associated. These symptoms are called angina. There are many treatments for angina, including medications, angioplasty and stents, and bypass surgery. Aggressive risk factor modification is part of every treatment plan. Coronary heart disease can have serious complications, including heart attacks and even sudden death. Fortunately, developing significant coronary heart disease is largely preventable. Early prevention is best, but you can still improve how you'll do, no matter how old you are, by reducing your risk factors. One study found that 50-year-old people who had not already developed significant cardiovascular disease and didn't have major risk factors reduced their lifetime risk for developing significant cardiovascular disease, and they live longer. Continue on through this section to learn more.